Raised blood pressure or hypertension in pregnancy. Very often we come across this situation during the pregnancy. What is this situation? Why do we get it? Who are at risk for getting this problem? What are the various signs and symptoms by which doctors diagnose it? And last but not the least is, when will you go to the doctor? What are the warning symptoms that you come across when you have to reach the doctor? This is what we're going to discuss in this video. Hi, I'm Dr. Mukesh Gupta, obstetrician and gynecologist from Lennox Mallard. Blood pressure during the pregnancy, if it increases more than what we expect it to be, can cause a lot of complications. Now, what is the way to diagnose and what is this problem? So, a pregnant woman, when has a raised blood pressure than what normally she would be having it can be more than say 30 millimeters of systolic mercury from what she already had, or even a diastolic raised by 15, for example, or a basic cutoff of 140/90, then we consider it as a high blood pressure. But mind you, we have to understand that this is not just a simple diagnosis, because raised blood pressure can be because of inherent, originally the woman having a raised blood pressure, we call it essential hypertension, or it can be developed during the pregnancy, which we call as gestational hypertension, or it can be a superimposed situation where you already have it and now it is increased. Now, gestational hypertension or pregnancy-induced hypertension, that is PIH, which is the common terminology, is diagnosed when the blood pressure raises beyond the 20 weeks of gestation. And if it is before 20 weeks, that is the first half of pregnancy, then it is more often an essential hypertension. There are a lot of complications that can be associated with it. Although it is simply defined as raised blood pressure, but it is associated with swelling or edema over the body, your legs, your face, and everywhere. And also it is associated sometimes with proteinuria, that is leaking of protein in the urine. In this situation we call it preeclampsia. Sometimes it can get complicated and a woman can throw a convulsion, and that is called as eclampsia. A Greek word, eklampin, is the origin of this word, which means flash of lightning. So this is what raised blood pressure is all about. So this is the first issue which I wanted to discuss. Now the second issue is, who are at risk of landing up with raised blood pressure? So the WHO or the FIGO guidelines, everybody says that anyone and everyone who is pregnant is at risk. Okay, so meaning everyone needs to be screened for finding out whether they are at risk or not. But having said that, a woman who is pregnant for the first time, especially at a younger age in early marriage, or a woman who is having an extremely high age, elderly woman, age criteria, weight criteria, if the weight is on the higher side or obesity is there, if there is a pre-existing history of blood pressure or diabetes in a woman, also especially in some situations where there is a strong family history of raised blood pressure, that is another factor. Some renal diseases, autoimmune diseases, maybe APLA syndrome, etc. also predisposes a woman to all these complications. So what exactly are the complications that a woman can have which needs to be picked up? Now I'm going to come to that towards the end of the session to explain you the importance of this. But before that, let us understand the third issue. Why do we have it? Now normally a woman during the course of pregnancy passes on the blood to the baby, and it has to go without any resistance. But if there is any resistance to the flow to the baby, the body tries to pump the blood very hard into the baby, and that is one of the factors which leads to that. Although lots of theories have been proposed to explain raised blood pressure, but there is a basic pathophysiology, that is abnormal placentation, meaning the placenta which gets connected to the mother and connected to the baby actually has not developed well in the mother's womb. Second thing is, there is a little bit of abnormality in the microvessels or microvasculature in the mother, and that is the reason why this happens. So that brings us to the next very common issue, that is the fourth issue, that how do we normally diagnose it as a doctor? Well, if a woman who is beyond the age of 20 weeks of gestation has raised blood pressure beyond say 140/90, then we are worried. Or suddenly her BP was, say, for example, always it has been 100 and suddenly it has become 130, then also we are worried. This is the first sign, that is blood pressure. Second thing that we are concerned about is the swelling or edema. Swelling is very common in any pregnant woman, but if it happens early in the morning when you get up, in spite of practically resting whole night, then it is something which is significant. And swelling is not just limited to the legs, but it is all over the body, the face and the fingers. Then we are really worried. Another very important way to diagnose is the clinical signs. Now, these clinical signs, besides the raised blood pressure and swelling, is urine examination to check for leakage of proteins or albumins in the urine. So these are the few common things that we use to diagnose a raised blood pressure or preeclampsia. There are some point of contact tests now which we are available, like the Lumella test or the fetal fibronectin tests, which have been tried and experimented, which is still being validated, but those are interesting and very promising tests which are now available to us. But there is another way to diagnose that, and that is screening. Now, what is this screening all about? Screening means that we try to find out who is at risk of blood pressure much before they actually develop that. And how do we do that? It can be done by a blood test, it can be done by a BP recording, or it can be done by a sonography. Yes, sonography. Way early in the 3rd month, when a sonography is done, and if it shows increased resistance of the uterine artery, we call it pulsatility index. Your doctor may be able to explain you. If that is high, that means there is a risk of raised blood pressure future in the pregnancy. Sometimes some blood tests which are done, which tells us that you are at risk of antiphospholipid antibody syndrome or hemophilia-like defect, can also be associated with raised blood pressure. So this is how we diagnose that. Lastly, one of the most important thing is that when do you go to the doctor thinking that this may be a problem in you? If you get swelling in the morning when you get up and it is there in spite of resting, you need to go to the doctor. If you have a sudden weight gain, say more than 2 kgs per month, or maybe half a kg a week also, then also you have to go and meet your doctor. Suppose if you have complications of that, say for example you have blood pressure which is high and suddenly you develop some premonitory symptoms. What are these premonitory symptoms? Headache, nausea, vomiting is common thing, but this time you have a lot of irritable vomiting, epigastric pain, blurring of vision. Last but not the least, disorientation or irritability. If any of these signs happen, you rush to the doctor. I'm going to repeat it for you to remember. Headache, blurring of vision, epigastric pain, that is in the site of the liver, irritability or restlessness. If these signs are there, I would suggest you have to meet your doctor immediately. That is when they will be able to guide you. For having more information on the management of these diseases, I'm going to give another video very soon. Wait for that. Thank you very much.